Today I'm discussing a little bit about the TFL, or Tensor Fascia Latae. So before I begin, I want to let you guys see what book this is. It's Volume 2, Myofascial Pain and Dysfunction Trigger Point Manual with TFL and Simons. I think you can pick that up on Google or Amazon or whatever, okay? All right, getting back to the TFL. First, just anatomically, we got to understand that this muscle, it's not that big, but it attaches on the front part of your pelvis here, or hip bone, and ties in midway down your thigh. Okay, so that's the length of the TFL. And this muscle, when it gets shortened or affected, or you get some trigger points in the area, you can get a lot of knee pain. Okay, I'm going to zoom in a little bit here. It's showing an active trigger point here, and it's a referral pattern that can come from this. Now, many referral patterns can come from this when you get tightness or spasming or trigger points, but the normal pattern would be going from this upper ridge all the way down the side of the thigh, even into the knee. A lot of times it'll jump into the knee with many people I work with. So be aware of that you can have actual knee pain from this muscle above, right next to your hip. Okay, that's important to realize. It's not always the muscle that's spasming, but sometimes you have a trigger point that's actively affecting the knee. Okay, and we can be, if you realize the pelvis can shift down or up, if this point drops down in like an anterior pelvic tilt, a lot of times you'll have shortening of that tissue. You can imagine this point coming lower, this going higher, and causing spasming or tightness there. Okay, that's something to be aware of. Also, you want to be aware how this area here is affected with this IT band. So here's the iliotibial band. Okay, let me take this other picture here so we can look at this a little closer. All right, so TFL merges into the IT band, okay? And if you have tightness here, you can pull on this IT band or cause tension in here. And this can also be a contributor to knee pain, front or back, and even affect the lateral aspect of your lower leg. So all those are symptoms that can contribute or come from the TFL. People ask, well, what can I do about that? There's a few things you can do. We can stretch this muscle to affect the tension. You can foam roll it. But what I like to talk about today is how do we kind of offset the tension of this tissue? If we think about the inner thigh or the adductors, it's on the other side of this. I don't know if I have a quick photo of that, but this will work. Okay, so let's look here. So the tissue runs on the outside of the leg, but the adductors runs on the inside of the leg, okay? And many times if you have tightness here or pulling, your leg is going outward or lateral, and it can weaken the inside or the adductor muscle. So activating that muscle can have an impact on reducing the tension in your TFL. I'm going to show a simple adduction move that can help take some pressure off this. And take a look just after this explanation. I'll have a few videos you can give a try. Okay, hope you enjoyed this, and thanks for following. The position of this and kind of inhibit this tissue. So get a pad, put it underneath the knee, and what I want you to do is just activate your adductor. You're just going to push downward in the knee here, and you're going to activate the adductor inner thigh muscles. All right, so you're going to press there. As you're pressing down, you're going to do a little internal rotation with the hip joint. So you're going to rotate upward. Okay, keep this posterior tilt. Feel the activation maybe a little bit in the TFL, but focus on your adductor. So you're pushing down, okay? And breathe deep. Inhale, exhale, stay neutral, maybe 3 breaths. After that, just relax, okay? Let the leg relax. If you had somebody back here, they could put you into a little stretch, okay? Take you into a little range of motion, but this is for yourself, okay? The goal is trying to see if we can get this knee to drop a little lower and just open up this line a bit. And it's already moved a little bit for us.
Make sure we don't cheat it and get into the antidote. We stay.
Get a bench, okay? Support yourself on it. What you're gonna do is bend this leg, you're gonna straighten your bottom leg, okay? As you straighten your bottom leg, what I want you to do is let this hip just drop down until you feel a pull right here in this region. Feel a little stretch. Your shoulder bug, you make sure you stabilize up here. But the stretch is here. You maybe hold for about a count of 10. You come out of it, okay? And drop right back into it and feel the stretch into the lumbar on the lateral aspect. I'll show you from behind. Okay? It's here, leg out. We're stretching this part of your back. Going down, stretch, and back out.